Hello everyone. Today I am going to talk about aminoglycosides. So let's start. First of all, what is the classification of aminoglycosides? So these are the drugs which are present in this class. Amikacin, gentamicin, tobramycin, kanamycin, netilmicin, streptomycin, neomycin. So these are the drugs which are present in aminoglycoside class. Now, what is the mechanism of action of aminoglycosides? So, aminoglycosides diffuse through porine channels in the outer membrane of the susceptible organisms. Okay, so it enters through porine channels, and inside the cell they bind the 30S ribosomal subunit where they interfere with assembly of the functional ribosomal apparatus and are cause the 30S subunit of the completed ribosome to misread the genetic code. So these are protein synthesis inhibitors and antibiotics that disrupt protein synthesis are generally bacteriostatic, but aminoglycosides are unique in that and they are bactericidal. So please remember this, that aminoglycosides are protein synthesis inhibitors, but these are bactericidal. Now, coming towards the pharmacokinetics of these aminoglycosides. So, the highly polar polycationic structure of the aminoglycosides prevents adequate absorption after oral administration. Okay, and all aminoglycosides except neomycin must be given parenterally to achieve adequate serum levels. Okay, so neomycin is not given parenterally due to severe nephrotoxicity. This drug is very severe nephrotoxic drug. Okay, so this drug is not given parenterally, while the other aminoglycosides, uh, these must be given parenterally. Okay, to achieve the maximum serum level. Now, all aminoglycosides cross the placental barrier and may accumulate in the fetal plasma and amniotic fluid. Okay, so please remember this. More than 90% of the parenteral aminoglycosides are excreted unchanged in the urine, and accumulation occurs in patients with renal dysfunction and dose adjustment are required. Okay, so aminoglycosides are nephrotoxic drugs, so we need the dose adjustment in renal patients. Okay, now coming towards the antibacterial spectrum of aminoglycosides. So these drugs are effective for the majority of aerobic gram-negative bacilli, including those that may be multi-drug resistant, such as Pseudomonas aeruginosa, Klebsiella pneumoniae, and Enterobacter species. Okay, so these drugs are effective against these organisms, and these drugs have a synergistic effect with beta-lactam antibiotics, particularly in the treatment of Enterococcus faecalis and Enterococcus faecium infectio endocarditis. Okay, so in against these organisms, it have a synergistic effect. Okay, it have a greater effect when we combine these drugs with beta-lactam antibiotics. So the combined effect will be greater. Okay, so now coming towards the resistance. So there are three mechanisms involved in the resistance. So when activation of the efflux pumps, when efflux pumps activated, okay, so the drug will become out from the organism, and this is one mechanism. Decrease uptake, okay, and modification and inactivation by plasmid associated synthesis of enzymes. Okay, modification and inactivation by plasmid associated synthesis of enzymes. So these are the three mechanisms which are involved in the resistance of aminoglycosides. Now, what are the adverse effects of these drugs? So first of all, it causes ototoxicity. These drugs are very famous for ototoxicity. Deafness may be irreversible and has been known to affect developing fetuses. Okay, deafness may be irreversible. Please remember this, and has been known to affect developing fetuses. Neuromuscular paralysis and contact dermatitis is a common reaction to topically applied neomycin. As I already told you that neomycin is not given parenterally because it is very high nephrotoxic drug. So we use this drug topically. But when we use topically neomycin, it causes contact dermatitis, which is a common reaction related to this drug. Moreover, 25% of patients receiving these drugs for several days or more have mild renal dysfunction. Streptomycin is the least nephrotoxic drug in the whole class. Please remember this. While neomycin is the most nephrotoxic drug in the whole class. Okay, so streptomycin is the least nephrotoxic drug. It causes less nephrotoxicity, while the neomycin is the most nephrotoxic drug. Gentamicin and streptomycin causes irreversible vestibular damage. Okay, please remember this. These are very important. That gentamicin and streptomycin causes irreversible vestibular damage. Neomycin, kanamycin, and amikacin causes auditory damage, hearing loss. Okay, so you should be careful about the adverse effects of these drugs. Netilmicin. Netilmicin is the least ototoxic drug in the whole class, while tobramycin is the most ototoxic drug in the whole class, which causes both auditory and vestibular damage. Okay, so please remember this, that netilmicin is the least ototoxic, while tobramycin is the most ototoxic drug in the whole class. Okay, which causes both auditory and vestibular damage. So the adverse effects, like these are nephrotoxic, these are ototoxic, and these are neurotoxic. So please remember these adverse effects of the aminoglycosides. Now coming towards the therapeutic uses of the streptomycin. So this drug is used in tularemia. Tularemia is an infection which is also called rabid fever, and this is caused by a bacteria which is called Francisella tularensis. Okay, and this drug is also effective in plague, which is caused by a bacteria called Yersinia pestis. Okay, and this drug is also effective in acute brucellosis. Brucellosis is also an infection, and the causative agent of the brucellosis is Brucella species, specifically Brucella abortus. Okay, and this drug is also effective in TB as a second line agent. Okay, so these are some of the uses of the streptomycin. Now, what are the uses of the gentamicin, tobramycin, amikacin, and netilmicin? So these drugs are effective in endocarditis, okay, meningitis, pneumonia, UTI, urinary tract infection, osteomyelitis, peritonitis. Okay, so these are the infections in which these drugs are effective. Now, what are the uses of the neomycin? So neomycin is effective in burns, skin and mucus infections. Okay. Now, what are the doses of these drugs, and the elimination route, the half-life, administration route, okay, and the common dosage range? So amikacin, the elimination route of the amikacin is renal. The half-life is 2 to 3 hours. Administration route is IV or IM, and the common dosage rate is 15 milligram per kg per day, once daily dose. Okay, and gentamicin, it is also eliminated renally, and the half-life is 2 hours. the administration route is IVIM, and the dosage range is 3 milligram per kg per day. Okay. Similarly, kanamycin is also eliminated renally, and the half-life is 2 to 4 hours. And kanamycin is the administration route is oral or IV, and the dosage range is 15 milligram per kg every 8 to 12 hours. Okay, so the new mycin is also eliminated renally, and the half-life is 2 to 3 hours. Okay, and mostly this drug is used topically, and 50 to 100 milligram per kg per day. This is the dose orally, but it is very high nephrotoxic drug, so we use this drug topically, and the dose of this drug is 10 to 15 milligram per day topically. Similarly, netilmicin is also eliminated renally, and the half-life of this drug is 2 to 7 hours. IV or IM is the elimination route, and the common dosage range is 3 to 6 milligram per kg per day. Okay, for streptomycin, the elimination route is renal, and the half-life is 2 to 3 hours, and the administration route is IM, and the dose is 15 milligram per kg per day. Okay, and for tobramycin, the elimination route is renal, and the half-life is 2 to 5 hours, and the administration route is IV or IM, and the dose range is 3 milligram per kg per day. Okay, so this is the end of this presentation, and if you have any question related to this topic, you can ask in the comment section and I will answer. Okay, and if you are new to my channel, you can please subscribe to my channel, because I am daily uploading the lectures on the pharmacology and the other subjects, so it will help you. Thank you so much.